Good evening. You're watching The Big Story with Dylan Ang. I'm Olivia Quay, coming to you live from the Straits Times newsroom.
The World Health Organization officially declared the coronavirus a pandemic, which it defines as worldwide spread of a new disease. There are now more than 118,000 confirmed cases reported across at least 114 countries.
WHO has been assessing this outbreak around the clock, and we're deeply concerned both by the alarming levels of spread and severity and by the alarming levels of inaction. We have therefore made the assessment that COVID-19 can be characterized as a pandemic. Pandemic is not a word to use lightly or carelessly. It's a word that, if misused, can cause unreasonable fear or unjustified acceptance that the fight is over, leading to unnecessary suffering and death. Describing the situation as a pandemic does not change WHO's assessment of the threat posed by the virus. It doesn't change what WHO is doing, and it doesn't change what countries should do.
To discuss this, we're pleased to welcome back Dr. Leong Hoe Nam. He's an infectious diseases physician from the Rofi Clinic at Mount Elizabeth Hospital in Novena. Now, Dr. Leong, the big news today, the WHO classified the coronavirus as a pandemic. The WHO chief himself said it doesn't change how countries are viewing and combating the virus. So is calling it a pandemic more symbolic than anything, or does it actually mean something?
I think it's more of an academic exercise. If you look at the word pandemic, it actually means widespread infections occurring simultaneously at different countries, at different places. So it fits the criteria very well now. In fact, it fit the criteria even a few days before. But the WHO was reluctant until they had sure confirmation, and truly all continents have active transmission now. But does it mean any difference for you and me? No. What happens in Singapore, what happens in the States, Italy, Europe, South Korea, life goes on, and we have to continue fighting this virus. Now, even though we have called it a pandemic, WHO actually says we still can try and control the virus totally and fully.
Now, Dr. Leong, let's dive a bit deeper. Now, a pandemic indicates that the virus has actually gone global, which we have seen for a while now. Why do you think the WHO waited until now to designate the coronavirus as a pandemic?
There were many places not in Asia Pacific nor in Europe, specifically in North America and South America, where they want to see active transmission ongoing that's not just isolated in a few places. If you realize in the last couple of days, New York City, they have a lockdown, or rather not really a lockdown, but a controlled curfewed area to restrict movement of people to and fro. So to me, that means there's active transmission in New York. With that, it is yet another location. With that, they have confirmation it's widespread throughout the whole world, hence the word pandemic everywhere.
Right.
But Dr. Leong, do you also think it's because the WHO prematurely called H1N1 a pandemic back in 2009 only for the virus to peter out, and because also neither did SARS nor MERS were called pandemic? So we know that WHO is very careful about labeling something a pandemic.
Absolutely. If you look at the word pandemic, it just means there's widespread infection across the different continents throughout the whole world. It doesn't describe the severity of the infection. So in the case of H1N1, it was actually much milder than originally thought. So what if it's a pandemic, but it is a relatively mild virus? The word pandemic doesn't describe the severity. In the case of MERS and SARS, it were pretty much localized to the Asia Pacific for SARS. MERS is pretty much just the Middle Eastern countries. So very localized, you can't call it pan as in widespread. Hence the reluctance to call it pandemic for those two viruses.
Now, Dr. Leong, back in Singapore, Health Minister Gan Kim Yong said several confirmed cases had not minimized social contact, although they were unwell. Do you think we've been complacent?
Yes, I think we have been a bit complacent. I would dare say Singaporeans in general are doing much better than many of the other foreign countries we are familiar with,
Right.
European countries, for example, but we can do it much better. Now, if you really want to try to control the virus, we need to get a lot of testing done, and that has been activated. The Ministry of Health is doing a lot of testing in the various hospitals. The next layer, which is the higher level and more difficult layer, is that anyone who has a sniffle, has a cough, feeling unwell, any of these, not all, but any of these, if you stay in at home, that will help to control and curb the epidemic. Unfortunately, we have not been diligent enough, we have not been responsible enough. So we need to take this to a higher plane if we want to control the infections further.
Right. Well, on that note, now that the number of new cases in Singapore has started to increase again, do you think the public will start being more vigilant and mindful about social distancing, our personal hygiene practices as well?
I certainly hope so. My fingers are crossed. I do hope with more cases coming out and more reports from overseas, and the fact that many people are bringing disease back into Singapore again, Singaporeans will remain vigilant. Not in the sense it's not going out, but vigilant in your own self, checking a thermometer, checking if you have a fever, you have a cough, or simply feeling unwell somewhere. Any of these, you should not go out, you should stay at home. If need to, go and get a medical leave certificate for 5 days. And for those people who are employers out there, please be tolerant. Tolerant that your staff may not be coming in because they're unwell, not rather because they're trying to Skype or stay away from work. You also be tolerant of the fact that it's better that one person stays away from work than having your entire office quarantined thereafter.
Right. Great advice. Thank you so much for your time, Dr. Leong. We've been speaking to Dr. Leong Hoe Nam, an infectious diseases physician from the Rofi Clinic at Mount Elizabeth Hospital, Novena.
And just hours after the WHO declaration, President Donald Trump announced that the United States will suspend all travel from Europe for 30 days to slow the spread of the virus.
To keep new cases from entering our shores, we will be suspending all travel from Europe to the United States for the next 30 days. The new rules will go into effect Friday at midnight.
However, the travel restrictions will not apply to the UK, which, according to Mr. Trump, has taken more precautions than the European Union against the virus.
Meanwhile, India's Ministry of Health announced on Twitter that all existing visas issued to foreigners, except those on official duties, remain suspended until April 15th. But visas of all foreigners already in India are valid.
In Italy, a hospital in the southern city of Naples is assembling a new intensive care unit as the healthcare system braces for an epidemic. Italy is the hardest hit country in Europe, with over 800 deaths and nearly 12,500 people infected.
And in the UK, Prime Minister Boris Johnson is set to announce that the country is moving to the second phase of its 4-tier plan to manage the coronavirus.
But the number of fresh infections in the epicenter of Wuhan dropped to a new low of 8. The whole of mainland China saw 15 new cases. Another 11 people died, which is the lowest daily increase since late January. Well, yesterday, Dylan had an interview with Professor David Heymann, who was the World Health Organization's Assistant Director General for Health Security and Environment. Professor Heymann is based in London, but he's in Singapore this week.
Joining us now is Professor David Heymann. He's a Professor of Infectious Disease Epidemiology at the London School of Hygiene and Tropical Medicine, as well as the head of the Centre on Global Health Security at Chatham House in London. Welcome, Professor. Thanks for joining us. Now, the first question, an infectious diseases program leader was on the show earlier this week, and he said the virus is here to stay at least until the end of the year. What are your thoughts on this?
Well, that's a good estimate of what might happen, but it's only an estimate. And we really don't know what this virus will be doing at the end of the year, but it looks like it now is transmitting fairly easily in communities in Europe and around the world, and it's very likely that it will continue to transmit at least for a time.
Now, Professor, speaking of the virus, is the virus changing? And if it is it for better or for worse?
Well, looking at the genetic sequence of the virus, which is one way of determining whether the virus is stable or not, it appears to be quite stable. And it's stable and it's never been linked yet with either virulence, which means how easily it causes disease, or with transmissibility. So what we're seeing is a virus which is stable and which hasn't altered either in its transmissibility or in its virulence.
Now, Professor, let's move along to cruise ships. Now, some countries are not allowing cruise ships to dock at their ports for fear that they could spread the disease in the day or two that passengers and crew spend in a country. Are cruise ship passengers a greater risk than passengers coming in by plane?
Well, cruise ship passengers are a risk because they're enclosed in a space and they can't move around.
Right.
And so if there's transmission during the period that they're on that cruise ship, they're very likely to get infected if they're exposed to the virus. On an airplane, it's been shown in the SARS outbreak back in 2003 that the people who are at risk are only those who might be sitting in the row in front of or in the row behind someone who has the infection. So there would be less possibility of infection on an airplane than on an enclosed space, for example, on a cruise ship.
Now, Professor Heymann, let's look forward. How do you think things will develop? Will more countries face sudden outbreaks like what we saw in Italy?
What we're seeing now is that countries are trying their best to contain outbreaks which occur in their country and which are discrete, such as has been done here in Singapore. So countries are trying to interrupt transmission and outbreaks and therefore delay the onset of what might be community transmission. However, in many countries, there's also community transmission occurring at the same time, and that's also being studied to determine whether or not it will continue to spread at the same time that countries are preparing for a major outbreak should it occur.
Now, on that note, will we see second and third waves of outbreaks in places where the number of cases seem to be declining?
Well, there's a concern that that may occur, but no one is able to predict that with certainty. So what we need to do now is work as Singapore has worked to stop outbreaks where they're occurring and to try to understand how disease transmission might be occurring or might occur in the future, and at the same time getting hospitals ready for a surge of severely ill patients who need respiratory support if indeed that surge comes.
Now, Professor Heymann, just a final question. How soon can a vaccine be available, and will that solve all our COVID-19 problems?
Well, there's a lot of work now to develop a new vaccine, and it's probable that that vaccine might not be available and licensed before early 2021. After licensing, then, there will be a need to find production facilities that can produce the quantities of vaccine necessary to deal with this outbreak should it continue. So we're a long way away from having a vaccine that's licensed, and then even further away from having a vaccine that's available on the shelves ready to use.
Well, thank you so much, Professor Heymann, for your insights. That was, of course, Professor Heymann. Now, it's been a pleasure, Professor, and we hope to speak to you soon.
Thank you.
The Health Ministry is currently identifying and investigating 95 Singaporeans who attended a mass religious gathering in Malaysia in which several cases were confirmed. The event is believed to have taken place at a mosque on the outskirts of Kuala Lumpur between February 27th and March the 1st. It involved around 10,000 people from several countries. And as the fight against the outbreak continues, such as Cisco officers conduct regular checks to ensure quarantined people here adhere to the guidelines. Here's a look at how it's done.
My confident experience overcome my scaredness. Because I was involved in SARS before, so I got experience in SARS. And furthermore, my experience and confidence and support from my family and my colleague.
operations monitoring cell will actually perform the daily health surveillance and checks via phone call or video call. We also have the call center function to actually they contact the person under quarantine, or also known as PUQs, to actually inform them that they will be quarantined. They also handle inquiries from the PUQs or the member of public, and if they require any assistance such as to purchase medication or deliver items, then we will escalate to Ministry of Health and we work out a way to how to support them and provide assistance to them.
Okay, in general, whenever there's a virus epidemic or a virus widespread in Singapore itself, every assignment itself that we undertaken is relatively similar. Only difference is that you have the change in terms of the education of the public. Okay, comparing to SARS as well as monkeypox, able to now even for COVID-19. So it's important to actually to clarify the facts, and after which to actually educate the people, not only just the general public, but also our officers themselves, so that you actually know what exactly the real situation is, what is actually considered as a real fear, or basically put anxiety or at ease.
As the WHO declares the coronavirus a pandemic, let's take a look at the headlines beyond our borders. The NBA suspended the season until further notice after a Utah Jazz player preliminarily tested positive for COVID-19.
In football, Juventus defender Daniele Rugani also tested positive for the virus. He's currently asymptomatic, and Juventus said that it's activating all isolation procedures, including those who had contact with him. Juve is one of Europe's biggest clubs, with a squad that includes five-time Ballon d'Or winner Cristiano Ronaldo, who is back in Portugal.
And Oscar-winning actor Tom Hanks and his wife Rita Wilson have also tested positive for COVID-19. The 63-year-old wrote on Instagram that they sought medical advice after experiencing symptoms of a cold in Queensland, Australia, where he's currently working on a film about Elvis Presley.
And those are our top stories for today. For more news and videos, log on to straitstimes.com. And once again, I'm Dylan Ang with Oliver Quay. Join us tomorrow for more stories on The Big Story.